All right, hello, sir. I'm Jake. I'm with EMS. So, what's your name?
Dustin.
Dustin. Nice to meet you, Dustin.
You too.
So, how old are you?
48.
48. When's your birthday?
December 7th, 71.
December 7th, 1971. You know your approximate weight?
About 230 pounds.
230, approximately. So, was it you who called EMS?
Yeah.
Okay.
Yeah. My wife and I decided it was time to call.
Okay. So, why'd you call us today?
I've been having some abdominal pain.
Okay, some abdominal pain.
But the biggest thing was I've had some yellowing skin over the last. I noticed it a couple weeks ago.
Okay, so some yellow skin.
Yeah, and then my wife said that the last 2 days my whites of my eyes have become really yellow.
Okay, and then yellow eyes spotted by your wife.
Yeah,
Okay.
and that's when we decided to go ahead and call.
Okay, so when did that all begin?
I noticed the yellowing probably about 2 weeks ago
2 weeks ago for
Yeah.
yellowing.
on the skin.
Okay. What about the abdominal pain?
Probably almost 2 months
Okay.
for the abdominal pain.
You have any idea what might have caused it, maybe?
I don't.
Okay.
I wish I did because I'd make it stop.
Is there anything that makes it better or worse?
Nothing really makes it better kind of time, but I notice it gets real bad like after I eat.
Okay. So after you eat is when it gets worse.
Yeah, if I eat like a big dinner. A couple nights ago I had a big hamburger and it got real bad after that.
Ooh. Okay. Okay. How would you describe the pain?
Real sharp,
Real sharp. Okay.
like stabbing.
Okay. Sharp stabbing. Has there been any changes in your pain? Like, does it spread anywhere?
When it first started, it was kind of isolated to the like right side, like right below my rib cage.
Mm-hmm.
But as time's gone on, it's kind of become more diffuse, I guess, or more general, all over. And it started to become more up behind my right shoulder blade as
Okay.
well.
Okay, so radiates to your right shoulder blade. Okay. So you said it's more up in the right upper quadrant. So this is the right upper quadrant right here.
Yeah, just right below that, like the right side, just right underneath the rib cage.
Mm-hmm. And then you said it spreads to like your shoulder blade.
Yeah, here as it's gotten worse over time, I'm starting to feel pain up here as well.
Okay. So on a scale of 1 to 10, what do you think you would rate it?
On I guess a normal day, it's about a 7.
Okay.
But after I eat a meal, it's like a 10,
All right.
if not more. The scale will go higher, but
So normally at a 7, and then right after a meal, it's a 10.
yeah, like it'll double me over in pain. I can't move. I can't do anything for about 30 minutes to an hour.
Mm-hmm. So you said this began about a month ago, and then a few weeks. It's been your skin. Yellow.
Yeah. About a couple months ago, the belly pain started, and then about 2 weeks ago, I've noticed the yellowing of my skin.
Okay.
And then a couple days ago, the eye started.
So
according to my wife.
So is the abdominal pain? Is it constant?
It started out as kind of come and go. Over the last couple weeks, it's been more constant.
Okay. So more constant.
Yeah.
Okay. So did you do anything to treat this problem?
No, not really. I mean, I took some ibuprofen early on,
Okay.
but it didn't help it at all. So
So some ibuprofen. So have you vomited recently? Has there been any vomiting to this pain?
no, I've never thrown up. I get nauseous every now and then when the pain's real bad,
Okay.
but I've never thrown up from it. No.
Okay. So feel nauseous, but hasn't
Yeah.
thrown up. Okay.
Correct.
Okay. So overall, what's your general health status?
Pretty healthy.
Healthy.
I take some medicine for high blood pressure, but other than that, I'm pretty healthy.
Okay. So high blood pressure. Okay. Do you take any prescribed medications for that?
I do. I'm sorry, I don't remember what it's called right now, but yeah, I take a tablet for that every morning.
Now you said you take some ibuprofen. Do you take any other over-the-counter medications?
I take a daily vitamin,
Okay.
just a multivitamin every morning.
So some vitamins. And for your high blood pressure, do you take your medications as directed? Like, do you take it at the right time?
I take it. I think so. I mean, I take it every morning with
So every morning.
with my multivitamin. Yeah.
Okay. So every morning. Okay. So have you taken any medical care for this abdominal pain yet?
No, I haven't
Okay.
seeked anything out.
Do you have any allergies?
No.
No allergies. Okay. Have you had any recent surgeries?
Nothing recent. No. I had my appendix taken out when I was a teenager, but.
Okay. So you had your appendix removed years ago. Okay. So what's your nutritional status? Do you eat pretty healthy?
Oh, I think so. I mean, probably not as healthy as my doctor would like, but
Okay.
I mean, it's not terrible. I like my red meat and baked potatoes.
You take any drugs?
Just my high blood pressure medicine.
Okay. You drink alcohol frequently?
I might have a beer with dinner 3 or 4 times a week, maybe
Okay.
at most.
Okay.
That's about it.
Do you chew tobacco or smoke any cigarettes?
No.
Okay. Do you know your family medical history? Like, do they have a history of abdominal pain?
Not that I know of. My parents are pretty healthy.
Okay. Have you felt depressed lately?
No. I mean, other than dealing with the pain, but no, I've got a pretty good life.
Excellent. All right. So this is Dustin. He is 48 years old, has a chief complaint of abdominal pain and some yellow skin. Most recently, his wife has noticed his eyes starting to turn yellow, so it comes to my conclusion that it either involves the liver or the gallbladder. This time we will take him to the hospital for further evaluation.